People struggling with dementia, what they need most is compassion. They don't need our anger. They don't need to be told what to do. They don't need to be corrected. We need to be patient with them, and we need to be kind to them. And what I find is it requires a paradigm shift in our head. And this is where that grieving comes in. My mother, my father, my sibling, my aunt, they are not the same person. They are actually kind of regressing to a more childlike behavior. And in that regard, how can I be kind? How can I be helpful?
Well, this is our fourth episode of Fragments of Healing. And this evening I have with me Dr. Charles Slagen, my friend, Chuck Slagen. We're going to be talking about dementia. When the person we used to know starts to become somebody else. And how do we deal with that? What are the spiritual challenges? And though, the title is Fragments of Healing, we can't heal dementia or Alzheimer's. Just not happening in our lifetime, probably. How do we deal with it, though, spiritually, when we have to care for a person who has some serious dementia? So Dr. Slagen is with us this evening. He's got an interesting background. Started out life as an engineer, moved to the Boston area. While still an engineer, went to seminary. And after the first year at Gordon-Conwell Seminary, he realized his real calling was ministry. And that set him on a path to be a Christian counselor. He has his Ph.D. from Boston University in Pastoral Psychology. For decades, he ran a Christian counseling center, which he called really using Christian perspective in counseling people. So I could say a lot more about him. He's a good friend of mine, and he's done so much good in this world. So, first of all, Chuck, give us some technical background on dementia, Alzheimer's, medical background, if you would.
Sure. Well, first off, dementia is not just a single disease by itself. It's like an overall term, like heart disease. It covers a wide spectrum of medical conditions, including Alzheimer's. Basically, dementia is caused by brain damage to brain cells. So when the individual cells start breaking down, they start interfering with their ability to communicate with one another. And so when brain cells can't communicate normally, thinking process or thought process, behaviors, relationships, feelings can become affected. And this triggers then the decline of cognitive abilities and sometimes becomes severe enough to impair daily life and independent function. Alzheimer's is probably the word most of us are familiar with, we've heard, and Alzheimer's accounts for something like 60 to 80% of the cases of dementia. Second to Alzheimer's is something called vascular dementia, which is kind of like microscopic bleeding or little blood vessel blockages in the brain. But that's really the simple piece of dementia, is that it's basically the brain cells beginning to deteriorate away. The interesting piece is we typically associate old age or aging with dementia, but there's actually a lot of people who are 80, 90 years old that don't have a speck of dementia along the way. So it's not really connected with aging specifically, but there's a lot of us older people who have dementia. So that'd be the simple piece.
And it could start earlier than that, too.
Yes.
When it's Alzheimer's. It
Yes.
can start when the person's in their 50s, 40s, late 40s and 50s. So that's the medical background. It's not, as some people would say, they went crazy. Not at all. It
No.
is a brain thing. What are the signs? Let me give you an example. I can always tell if a parishioner is starting to get dementia. The refrigerator check, the light bulb check, the carpet check, all these types of things. I'm experiencing this. However, when my mother was getting dementia, I did not see it at all. So I think, because this is going to hit all of our viewers, at one point in our life, this is going to hit us personally, a loved one. So what are the signs we should be looking for as a loved one, caring for our loved ones? What are the signs?
Well, and it's interesting. You talk about a family member, and then you talk about someone you go see.
Yeah.
Let me start with the fact that let me think of raising children. Dad, how you and I both raised some children, and we now have some grandchildren. We get to watch them. I don't see my grandchildren as often as I would like to, but my children I saw every day. I didn't notice sometimes how fast they were growing. People would come, oh, wow, so and so, look at how much taller they are, or whatnot. When you're not with someone day to day, you don't see the gradual changes. And so when you don't see the gradual changes, it's actually hard to miss the early or I should say, it's easy to miss the early warning signals along the way. It's actually easier for those of us who don't see someone very often to be able to say, this one's changed since the last time I saw them along the way. So that's part of that whole piece. And there is no simple test for dementia. So doctors don't diagnose it by drawing blood necessarily, or having you take a test or something of that sort. Now, there are certain proteins that are sometimes off in our brain, especially the hippocampus, we won't get too technical, part of the brain that controls memory along the way. And if your protein levels are too high, there's something going on there. So in that regard, that's part of why with Alzheimer's, memory is such an issue along the way. But as far as early signs, when you start hearing, or I'll say short-term memory starting to fade of, where did I put my car keys? Or people are making bad decisions, or there's some confusion of where am I along the way? Those tend to be some of the primary ones. Sometimes there's some difficulty in speaking. Sometimes we watch people just starting to wander. They'll be starting to walk down the hall, and they'll get themselves somewhere where they don't even recognize where they are. They start getting lost. Somebody who may be grocery shopping, they drove there, went grocery shopping, but can't find their car to get back home. Taking longer to complete maybe some normal tasks. If somebody is just house cleaning, it maybe they vacuumed the living room 3 times and they didn't even realize it. So again, when you start seeing longer periods of time, the other thing I find is when people start losing interest in some of their hobbies or some of their normal everyday events. Somebody would go for a walk every day, and all of a sudden they stop doing that. Any changes in routines or behaviors would be those early warning signs.
My mother, who was an excellent seamstress, she forgot how to sew. Hey, things I'm not picking up on, right?
Yeah.
Excellent cook. Her dishes got weird. These types of things, people changing.
Yeah. Something's supposed to have a certain spice in it, but all of a sudden there's some weird spice that got in there that didn't taste right.
Yeah.
Yes.
And I would say, Mom, this is interesting. All of these signs. So there's the medical, there's the signs we should be picking up on. And then tell me, you worked with so many people over the decades. What are the challenges you see presenting themselves? Not to the person with dementia.
No.
God, we can't even go there. That's too much. We have to have a different discussion on that. The challenges for the loved ones who have to somehow care for their mother, their father, their aunt, their uncle? What are the challenges there?
I think you said it earlier, Deadheart. The person starts changing. The person is no longer the person we've known.
Yeah.
And in that regard, I think the greatest challenge, I'm going to say, is grieving. Grieving the loss that my mother, my father, my sibling, whoever, my aunt, my uncle, they're not the same person anymore. And so I come to the word grieving because in actuality, most of us don't want to believe that we're losing a loved one. So typically we go into denial without even realizing we're into denial. I don't want to believe that so-and-so is really changing. Yeah, maybe they're having a bad week. Maybe they've had stress. Go home, sleep for a while, or maybe you'll see the doctor, see what's going on. But we really don't want to lose a loved one. And so one very natural thing is for us to kind of tell ourselves we're not really seeing what we're seeing, or we make up some reason for it. So the hardest part I found is to actually help a person, can I say, accept the reality of aging, accepting the reality that someone isn't going to be able to do what they used to do. Um, that I think is the hardest part.
Or be the
Second,
person they used to be.
yeah. The second part I usually find is we love these people. And so we try to be there. And one of the first things we try to do is correct them, fix them, tell them what to do, as if they're capable of growing or changing when just the opposite is happening. They're actually unwinding, they're kind of coming apart, and they don't have the ability to heal in that regard. So what we tend to do is frustrate ourselves, but we're also frustrating that other person. And part of the negative cycle there is that when we're constantly trying to tell somebody, do it differently, or how could you do that? All we're doing is getting that person upset. When they start getting upset, all of a sudden they start reacting a little different. They're not so nice. They're like, you're always mean to me. Why you? Who are you telling me what I should do? You're my child along the way. And so this becomes a negative spiral that just goes to a very bad place very quickly.
And worse, let's take another step worse, and I'll be very honest. I used to get angry with my mom. Repeat,
Right.
repeat, repeat. You're stealing my money. Where are my medications? You hid them. And I was getting angry. I don't know if this comes up for people often when they're dealing with a loved one. What do you do with that? And does that come up?
When doesn't it come up? And I'm going to be careful to say that's part of the denial that's there. Instead of recognizing that this person is changing, we get angry because we believe they can actually change and do it differently or not repeat that bit. So that anger is really part of our denial mechanism. And so the hardest part is to stop and really ask yourself, does this loved one really have the ability to change, to get healthy the way I want them to change? And hard to accept that they're changing in a way that I can't control.
Spiritually, how would you counsel a person that is dealing with all of that? Tell me. One size doesn't fit all. I know that. How would you?
Okay.
You're a Christian counselor.
I'm going to keep it simple. At the Last Supper, Jesus commands the disciples to love one another. That's in John chapter 13 somewhere. Forgive me, I don't know the verse. It's one thing to say love one another, but later on, Gospel of John chapter 20, 21, Jesus takes it a step further. Love one another as I have loved you. Ooh. I mean, come on. if it's love one another, I get to set the standard of what love means.
Yeah.
But when he says, love one another the way I loved you,
Yeah.
it was total sacrifice. It was unconditional. I really don't like hearing that because I'm not sure I'm always capable of doing that. But that's the challenge. That's the challenge.
Maybe. Oh, that was chapter 15, by the way.
Oh,
Maybe.
thank you.
Hey, I'm paid to do this.
I got it.
Yeah, maybe we need to put that up on the mirror. Love my mother, love my father, as Jesus has loved me, washed my feet, cared for me. Love the person in front of me.
From there, I'll say I don't know what the word love means. Okay. We can talk about maybe some actions. Jesus obviously going to the cross was an incredible act of love. I'm going to be careful to say my killing myself for someone who's got dementia, I'm not sure that's the kind of love they need at this point. I'm going to turn to the Apostle Paul in 1 Corinthians 13, that love chapter. Love is patient. Love is kind. And I'll hold those. People struggling with dementia, what they need most is compassion. They don't need our anger. They don't need to be told what to do. They don't need to be corrected. We need to be patient with them and we need to be kind to them. And what I find is it requires a paradigm shift in our head. And this is where that grieving comes in. My mother, my father, my sibling, my aunt, they are not the same person. They are actually kind of regressing to a more childlike behavior. And in that regard, how can I be kind? How can I be helpful? Those of us who've raised children, we've gone through that stage where they knock the milk cup on the kitchen table and it rolls over and lands on your lap, and we get mad and yell at the kid, "Why did you knock your milk over?" And the answer is because I'm a kid. We're able to pardon young children for their behavior because we understand them as young children. In working with someone who's got dementia, the biggest, most difficult thing is the paradigm shift that instead of this person who I've looked up to for how many years as an adult, somebody who trained me, somebody who taught me, somebody who loved me, now needs a role reversal. And
with love and kindness, though.
Yeah.
And it's the answer to grief. Love is the answer to grief.
Yes. Yeah. And what I'm also going to say, the person is changing. With dementia, there's a gradual deterioration. I'll say deterioration. Sometimes it's gradual, sometimes it's quick, but it doesn't happen overnight. There's a process that can take place over years. This is where, if you can more realistically recognize that a person is starting those early stages of dementia, you have not totally lost this person yet. You still have some great opportunities ahead of you. Sadly, I just recently heard of a 26-year-old boy who had a brain tumor. He was given 3 months to live. His parents basically both quit work to spend those 3 months with him and spent every day with him. And 2 weeks ago, he passed away. They did not regret any of those days they spent with him. They built actually some new memories that they could carry. Someone who's got dementia, I'm going to think of it as a person with a hard drive that's filled with an incredible amount of knowledge and information, but their hard drive is slowly crashing. At some point, all that information is gone. Trying to remember, there was one priest who told me when a person dies, a whole library dies with that person. That means you've got limited time.
Yeah.
Here's an opportunity where you can be patient and you can be kind. Jesus sacrificed his life. For me, one of the, I'll say, biggest commodities that I can sacrifice that has meaning to me is time. I can't go to the store and buy 2 hours. When you and I are done talking on this video here, this time is gone. In that regard, time is priceless to me. Sitting down with someone who is starting to get dementia, just spending the time with them, giving them a chance to tell you 3 times in a row how their tomato plants are growing, but they're not growing fast enough. And instead of saying, "You just told me that story," just listen to it again.
It's a great story.
And again, and again. And part of what you will be doing that's loving is that you'll be giving that person an environment of peace where they don't have to be anxious of, "Oh, did I leave the stove on?" Or you're actually keeping them mentally occupied.
Step into their world. Yeah.
Jump in and just let them be at peace with that. Right? Now, with that, I'm remembering with my mother, although my mother didn't have a lot of dementia, it was clear she was declining pretty quickly. And I realized I had a bunch of questions for her that I'd never asked her before. We pulled out the tape recorder, and this is one nice thing about dementia. Oftentimes, it's the short-term memory that goes, but the long-term memory is actually still pretty intact. So instead of trying to live in the present, which is where they're having a hard time living, go back into the past and watch them come alive. Let them tell stories about what it was like for them growing up. Let them tell the stories about what it was like when they first got out of school, when they maybe met your father or your mother, and how that all happened and what happened, or even the idea of what was life like before color TVs. What was life like before there was television? Now, these days, maybe it'd be like asking somebody, "What did you do before you had a cell phone?" Right? So
get the grandchildren over there too.
Yes,
and to bring out something different in them. Yeah.
Absolutely.
They'll see a young person, and something will turn.
And like you're saying, it also gives the grandchildren an opportunity of actually connecting in with a grandparent that they always looked at as somebody who was kooky or crazy, or because they didn't know what they were talking about. But now all of a sudden they can actually start speaking more coherently. Their stories hang together because we're now talking about the past, not short-term memory, and presents the grandchildren, I'll say, more of the person you remember rather than the person you're seeing right now.
A lot of good advice, and I wrote a lot of this down for me. I'm not going to repeat it because we have intelligent viewers who heard every word. They don't need me to summarize back. But you mentioned in one of our previous discussions, and I'm going to turn it for a bit. It's going to happen to you and me, Chuck.
Mm-hmm.
And what's the gospel reading you threw out at me once? It was John 21.
Wow.
Jesus and Peter taking the walk on the beach. After, "Did you love me? Do you love me? Do you love me?" Then what did he say to Peter?
"Feed my sheep."
Yeah, feed my sheep. But then what did he say to Peter? How is he going to die?
"Oh, you're not going to like the way you die. You're going to die upside down."
Yeah. And people have to carry you.
Yes, people are going to lead you where you don't want to go. Yeah.
Folks, it'll happen to you and me. Maybe, could be, possible. So, if it's going to happen to us, why don't we be nice to the people around us where it really is happening to somebody? It comes. Yeah. But there is always that Jesus there. He is somewhere in the picture, isn't he?
Yes. Now, I also mentioned dementia is a process that takes place. Our brain cells don't just all die away overnight. Um, One of the loving things we can also do many times for some of the people who have dementia who are aging typically have poor diets because they're not eating right stuff. They're not cooking the right foods and whatnot. There's a lot of research that's been done about healthy brain foods. And I won't go into detail of that. A lot of people can just look up on the internet. Um, Let me think back. I have this wire here right now that goes to my earphones. Well, there's a plastic coating on the outside. The wire is on the inside. In your brain, think of their wires like this. The plastic on the outside is called the myelin sheathing, and it's like an insulator. What ends up happening is that myelin sheathing starts falling apart, so the bare wire is showing, and then it shorts out. Well, there are great foods that can really help us rebuild that myelin sheathing. Now, somebody with dementia isn't going to kind of turn the corner and start getting better, but you can actually start slowing down the rate of decline along the way. The other thing we know, for example, is that oxygen is an important part of healthy brain functioning. When I think of elderly people, what do I think of with regard to the amount of exercise they get? Right? Invite one of these people with dementia to go for a walk around the block. And we're not trying to kill them, right? I'm not trying to do cardio for 20 minutes, but just to get up and slow pace walk around the block, down the hallway, whatever, you will actually be enhancing the oxygen flow to their brain. That's an act of love.
And it's contemplative for us. We get something out of it too.
Yes. By the way, the food stuff I was talking about, remember when you were, I should be careful, I'm going to date you and I did it. There used to be this one cartoon character called Popeye.
Mm-hmm.
What was the food that he always ate?
Yeah. The spinach that he
Spinach.
could pop open. Yeah.
All right? Yeah. Spinach, kale. Those are actually one of the best foods to help increase the myelin sheathing in your brain.
Wow.
Now, again, I'm just leaving simple things you can do that can actually help a person not decline as quickly as they might without your help.
All right. So, Chuck, I want to thank you for being here. And my take from this was that 1 Corinthians chapter 13, the person is changing, so be kind to the person. Step into their world. I just want to thank you just for illuminating people on the medical, the causes, and what we can do, and spiritually what we can do to meet these challenges that are going to happen to all of us.
Yes. Yes.
Thank you.
Can I throw a last piece out there?
Sure.
We're talking about how to love them. One of the things that we're finding in research is music. Music actually crosses over both sides of your brain. You have a right brain and a left brain. We don't understand why, but when we do like the MRI research, we can see that music, when somebody's literally singing, and if you don't have to be singing out loud, you can be singing in your head, literally lights up both sides. One of the things we've heard so many times is when people go visit somebody in the hospital or whatever, what do? We sing hymns with them. We sing with them. And what do those people do? They join right in because so many of those hymns are just etched so deep inside of us, right?
Yeah. Sometimes it's the last thing that's there.
Yeah. And so this is, again, when you're with someone, listen, what's an act of love? Start singing some hymns, some shadagans, and all of a sudden you'll see them come alive, and that's going to, in those moments, even draw them closer to Christ.
They start singing with me. It takes them back to a good place. You don't actually see it, but they're in that good place.
Yes.
Yeah, another good clue. Thank you. Yeah.
You're welcome.
All right. Well, with that, I want to end quickly with a prayer, but it's kind of what you said. Sometimes I'll sing the Surpas Fads
Mm-hmm.
to people, because everybody knows that tune. And think about the words, Holy God,
Yeah.
Holy Mighty, Holy and Immortal, you were crucified for us.
Man.
It's a love song.
Yeah.
And they buy into that love song all the time. There is a God.
Amen.
He is holy. He is mighty. He's
Yes.
always there. Because he was crucified for us. He's always there.
Yes.
Thank you so much.
You're
Thanks,
welcome.